I'm going in my presentation to provide some updates on some WHO resources on influenza immunization that have become available recently. I'm talking as a medical officer of the Initiative for Vaccine Research. This makes me automatically biased towards talking on maternal influenza immunization. Some of the resources that I will present will be from that subject area. When we look at this slide, we can see that despite the fact that influenza, it is in general accepted that influenza has a considerable disease burden, the implementation of influenza programs has been lagging behind in the past. Despite vaccination against influenza remaining the most important preventive measure against influenza infection, barriers to implementation remain. These include misconceptions on the need for vaccine, logistical issues, programmatic issues, but also cost issues, which force us to prioritize health interventions targeting specific risk groups to make introductions both health and cost efficient. Looking at this slide, we see the process on how these groups have been identified and what WHO is doing to provide the necessary data and also the support to countries to address uncertainties that are related to the implementation of influenza immunization programs, in particular maternal immunization. In 2012, the Strategic Advisory Group of Experts has suggested 5 risk groups for influenza. The highest priority was given to pregnant women, followed by healthcare workers, the elderly, children, and immunocompromised persons, without any particular order of prioritization for the last 4. In 2013, SAGE came up with a request to WHO that WHO should develop a process and a plan to move the maternal immunization agenda forward to support an increased alignment of data and evidence to serve public health needs and provide assistance to regulatory processes for maternal influenza immunization introduction. In 2013, also the Global Advisory Committee on Vaccine Safety, which is the second major advisory committee of WHO that looks into safety issues of vaccines, undertook an assessment of inactivated vaccines. This assessment found that there is no evidence on adverse pregnancy outcomes. So inactivated vaccines can be, and in particular influenza vaccines, are considered to be safe and recommended for use in pregnancy. The maternal influenza immunization project on the very right has been called to life in 2014 to address uncertainties that are related to evidence, regulation, implementation, and supply. Going one step back to the Global Advisory Committee on Vaccine Safety, the guidance that I've just been referring to has actually just come out a couple of days ago. So what I'm presenting on this slide here is the peer-reviewed publication in the journal Vaccine on the overview or the review of safety of immunization during pregnancy. The findings of the Global Advisory Committee on Vaccine Safety reconfirm that the complications of influenza disease during pregnancy that have been observed are in line with the WHO recommendations from 2012, making pregnant women the highest risk group for influenza immunization. There's no evidence available of adverse pregnancy outcomes, not only for influenza vaccines, but for any inactivated virus, bacterial or toxoid vaccine. The effectiveness of influenza vaccine has been demonstrated in pregnant women with the transfer of maternally derived antibodies that are protecting the infant. There's also excellent and robust safety profile of several of the inactivated influenza vaccines available on the market over many decades that also make this vaccine a good candidate for maternal immunization. On this slide, I introduced the WHO position paper from 2012, which provides the rationale for the 5 risk groups identified. There's also provided by WHO an information sheet on vaccine reaction rates. These sheets describe the safety profile of the vaccines and list any adverse events, be they mild or severe, that have been reported in literature, and provide background rates on these. The last product I would like to introduce in my presentation is a training course on vaccine safety. I understand that the audience to this call is quite widespread, and there are a lot of colleagues from the clinics involved and also healthcare workers that may benefit from information on the safety of vaccines. WHO has developed a vaccine safety training course which is available in English, in Russian and in French language at the moment. The course covers characteristics of vaccines. It provides explanations and definitions of what adverse events following immunization are. It gives an overview of the intricate nature of pharmacovigilance and introduce the main stakeholders that are required to monitor adverse events following immunization. And, the final component of the course covers risk communication, which in the times of internet and social media is becoming more and more relevant. In particular, as rumors tend to spread more rapidly than before, and false information may be available on the internet that may cause hesitancy towards vaccines that are actually safe for use. On this last slide, we see a screenshot of one of the pages of the course that explain on how vaccines work. Again, this course has been established to create shared understanding among professionals who work on vaccination and vaccine safety issues. These can be program or technical officers, pharmacists, medical doctors, nurses, midwives, community health workers. Basically anyone who may be involved in vaccination may benefit from either parts of this course or the entire course. The course is available free online, and you can take a small exam at the end that provides you with a written proof that you have taken this course. I hope you will enjoy this resource, and I hope that the previous updates have been helpful to understand the safety and efficacy of influenza immunization, in particular during pregnancy. Thank you very much.
Thank you very much, Philip, for the overview on the work WHO is doing on vaccines and vaccination. Now I will give a short summary of your presentation in Lithuanian, but please stay with us for a while if we need you for some questions maybe.
Thank you very much.
Trumpai apibūdinant, ką pasakė Filipas. Filipas, tiesą sakant, šiuo metu yra Estijoje, nors jis pats dirba Ženevoje pas savo būstinėje, bet jis yra Estijoje ir ten dalyvaus vėliau supratimo apie gripą dienos renginiuose. Tai labai smagu, kad jis prisijungia ir prie Lietuvos renginio. Taigi Filipas daugiau kalbėjo apie būtinybę daugiau informacijos apie skiepų nuo gripo saugumą ir tai, ką daro Pasaulio sveikatos organizacija, nes nežiūrint to, kad šie skiepai yra įtraukti į nacionalinės imunoprofilaktikos programas, tačiau vis tiek skiepų apimtis vis dar yra palyginti žemos ir dėl to gali būti kelios priežastys ir neteisinga informacija apie vakcinaciją, taip pat kitos priežastys, be kitų paminėtų buvo ir kainos, pavyzdžiui. Na ir PSO išskiria vėlgi minėtas 5 rizikos grupės, bet prioritetinė rizikos grupė yra įvardyjamos nėščiosios. Ir Filipas parodė bent kelis informacijos šaltinius, kuriuose yra apibendrinama mokslinė informacija apie tai, kad vis tik nėra duomenų apie neigiamas skiepų nuo gripo reakcijas nėščiosiom moterim ir ten pateikiamas šių skiepų efektyvumas. Taip pat pabrėžiama, kad imunitetas, kurį įgyja nėščioji, taip pat yra perduodamas ir kūdikiui, dėl to šie skiepai turi kaip ir dvigubą naudą. Taip pat buvo paminėti bent keli labai aukšto lygio moksliniai komitetai, kurios koordinuoja Pasaulio sveikatos organizacija, skirti bendrais skiepams, bet taip pat gripui ir skiepams nuo gripo. Tai strateginė patariamoji grupė, speciali grupė, kuri dirba su saugos klausimais ir ypač saugos informacija apie vakcinas, tai teisinga informacija apie galimas teigiamas pasiekmes, galbūt kai kurios šalutinius poveikius yra labai svarbi. Ir PSO yra parengusi nemokamus online kursus, kurie prieinami per Pasaulio sveikatos organizacijos internetinį puslapį ir būtent mokymai apie vakcinų saugą. Ir šie mokymai yra skirti specialistams, slaugytojoms, medikams, taip pat vadybininkams imunoprofilaktinių programų ir visi kviečiami pasinaudoti šią mokymo priemonę ir tikimasi, kad ji bus naudinga.